children are being admitted with COVID-19 symptoms to hospitals. So this is according to the head of the intensive care unit at Chris Hani Baragwanath Hospital, Professor Rudo Mathivha. She says the shift in demographics is very worrying as the number of ill patients presenting to hospitals has increased exponentially. Professor Rudo Mathivha, the head of the intensive care unit at Chris Hani Baragwanath, joins me now live. Prof, a very good afternoon to you. Thanks indeed for your time. So I understand that you are admitting around 5 to 10 patients at a time, and these are children under the age of 12. How worrying is the situation?
The situation is pretty concerning because this is not something that we had observed with the first, second, and third wave. And it's not only those ages that we're seeing. We're also seeing young adults in their 20s, in their mid-30s, and a few adults in their late 40s. And also of concern is most of the young adults are unvaccinated. But coming back to the children, in the past, the children used to get COVID infection, and they would just treat it like any other childhood viral illness. And it wouldn't really put them down. It wouldn't really send them to hospital in big numbers to be admitted.
Yeah.
We are now seeing them coming in with moderate to severe symptoms, needing supplemental oxygen, needing supportive therapy, needing to stay in hospital for quite a number of days. What really broke my heart yesterday was a 15-year-old, previously well child, no illness, 2-day history of fever, comes into the hospital, tests positive for COVID, and literally deteriorates in front of our eyes. And nothing, no supportive therapy that we could do could help her. And we lost that patient. This is a 15-year-old. In the COVID ICU, there's a 17-year-old with COVID pneumonia on a mechanical ventilator. There are young pregnant women presenting in our maternity section. Yes, we do get a lot of pregnant women testing positive for COVID, being asymptomatic. But now we're starting to see a significant number presenting with symptomatology. And this is worrying. Now, if we're going to get children, toddlers, coming in great numbers, with significant severity of disease, this is going to be a major problem for us. Our hospitals were not built to house a lot of children because naturally, children do not get that sick in multitudes. We will not be able to accommodate them. And I'm not saying this to make people panic. I am saying this to say all these preventative measures that we take to interrupt transmission of COVID, let them be applied to the children as well. There is another thing that is bothering me, is that a lot of primary schools are closing left, right, and center. And they're not being announced in the news. And they're being closed because there are clusters of breakouts of COVID infection. Parents are just told, take it, and we will meet you next year. And it's not yet time for the school to be closed.
All right. Prof?
So there's a lot of infection in young children.
Prof, I guess the concern is also then from the demographic that you spoke about, 12 years and under, that group is not yet eligible for vaccination. Certainly that is proving to be a challenge because you are indicating that they're presenting themselves with moderate to severe conditions once they come into the hospitals.
Yes, that is a challenge. And that is something that we would urge our scientists and researchers to work quickly to assess what kind of dosage is needed to vaccinate those children. I think, as far as I know, 12-year-old and up have been cleared to be vaccinated according to recent clinical trials. It may not be in South Africa, but the lower age group, not yet. And we have to tread carefully. We cannot experiment with them. But as adults, their parents, we need to look after those children and make sure that we put them in a place where they're not exposed to contracting COVID disease. But I want to address the young 20s and the young 30s, the university students.
Yeah.
Please go and get vaccinated. You are our key to interrupting this sequence of spreading the COVID virus. If many of you are not vaccinated, it's going to have a field day.
Yeah.
It will spread.
All right, Prof.
And
Yes, sorry, Prof. We're running a bit out of time. I just wanted to address the other issue. You did mention a very sad incident that you've had to deal with at Chris Hani Baragwanath Hospital, where a 15-year-old had passed on as a result of COVID-19 complications. I mean, if you look at the mortality rate, what are we looking at this particular point? Is this the first instance that you've had at your hospital of a person this young passing on due to these complications?
This is the first incident of a child who had no comorbidities and nothing existing before that has passed from COVID that I am aware of. We did lose an 11-year-old last year, but that child had chronic renal disease, which is a risk factor comorbidity.
All right. Prof, we do appreciate your time. Thank you very much indeed for speaking to us here on The Full View on the SABC News channel. We look forward to speaking to you again as, of course, South Africa monitors an increase in the number of infections that are also expected to continue increasing over the next couple of weeks.